Hi, today we're going to look at a systematic approach to eye examination, making a close survey of the lids, the conjunctiva, the sclera, the cornea, the anterior chamber and the pupils. Your eye examination should start at lids. The lids include the orbital area. You want to make a complete survey of the orbital area, noting any erythema, swelling, deformity or wounds. You then want to move closer in to the lid margins, starting at the medial canthus, and survey along the superior lid, looking at the lid margin for any abnormality, wound. Look at the lashes for any crusting or discharge or any abnormality of the lashes. Work your way all along the way to the lateral canthus, and then do the same survey along the inferior lid. The next stage is the conjunctiva. Remember, the conjunctiva lines each lid and covers the globe up until your cornea. Look at the globe for inflammation and expose the fornices by pulling down the inferior lid, looking for any inflammation there or any debris. The next stage is the sclera. Remember, that's the hard outer part of the globe, the white part. You're looking for redness or any foreign body there. Next stage is cornea. Here we are looking at the lens which covers the coloured part of your eye, and you're looking for opacity there, which may indicate ulcer or any foreign body. You then want to move on to the anterior chamber. You will examine the anterior chamber in two ways. First of all, looking straight on, you're looking for any fluid line or any flare or pus cells that may be evident there. You then want to look at the anterior chamber from the side on, from the lateral aspect. Complete your eye examination by looking at the pupils. Check the pupils are equal, that they are of a regular shape and size, and that they both react to light. Hi, we're going to demonstrate the eversion technique. For this technique, all you will need is a cotton bud or Q-tip, and to ensure that your patient is sitting comfortably. With your patient's head in the neutral position, ask them to look down. Ed, could you please look down? Position your cotton bud approximately 1 centimetre up from the superior lashes. Grasp the superior lashes, push down with the bud and pull the lid away from the eye, exposing the subtarsal plate, and make a complete survey of the tarsal plate. Pull the lid down to return the eye to its normal position. That completes the eversion technique. The slit lamp enables us to produce 3 different colours of light to examine the eye via a filter control. These are white, blue, and green. It also allows us to change the frame of light from a circle for general survey of the eye to a slit for closer examination of the eye. We do this via the slit height control and the slit width control. The following is a road map, an orientation to the slit lamp, and then we're going to demonstrate preparing the slit lamp for patient examination. Okay. Essentially, the slit lamp is a microscope which you can take up to the patient's eye. It consists of 3 components: a binocular, a light source, and a tripod which allows you to take the table to the patient. Slit lamps differ in many ways, but generally they consist of the same components found in similar positions around the table. All slit lamps will have an on-off switch, and this is generally located round about the table edge. They will also generally have an elevation control, allowing you to move the table up and down. Your slit lamp will have a joystick control, allowing you to move the microscope towards the patient and also to elevate it up and down. Every slit lamp will have this section, the ocular head, with the magnification controls here at the front where your eyes settle. Round the side from the ocular head you have a magnification for looking closely at structures of the eye. Moving up you have the slit height control. This allows you to adjust the height of the aperture, and just above it is the filter control, allowing you to change the colour of light. Moving down the side of the structure you've got the slit width control, allowing for a nice slit of light for examination of the cornea. And coming back down to the base at the joystick is the rheostat. Not all slit lamps have a rheostat, which is basically a volume for allowing you to increase intensity of light, but generally this will be found near the joystick. If I move the slit lamp round, we find the area where the patient will be positioned. And here you have a chin rest and a head rest. Every slit lamp will have a small groove on the side which is used for lining up the patient before examination. This small groove should be in direct line with the patient's lateral canthus. If I turn the slit lamp further round, each slit lamp has a control for raising and lowering the chin rest, allowing for better positioning of the patient. That completes the road map of the slit lamp. Next, you want to prepare the slit lamp for examining the patient. First of all, think about yourself, the practitioner, and preparing the slit lamp for you. Put the table at a comfortable height for your seating position by using the up and down elevation controls. Turn the slit lamp on and make sure that it's working correctly. Then you want to zero the binoculars, the magnification at the binoculars. For general eyesight, we shouldn't need anything stronger than the zero setting. You then want to set the width of the binoculars so that it's correct for your eye width. Produce your light source by switching on the machine. Produce a white light, a round light, and turn the rheostat, the volume intensity, down to the lowest so that you've still got a light. You then want to position your patient. Getting the patient seated comfortably, advise them to rest their chin into the chin rest and place their head against the headrest. You then want to line them up appropriately using the groove on the side of the slit lamp. This should be lined up directly with the lateral canthus of their eye. Once you've positioned the patient and you're comfortable with the positioning of your binocular, you're ready to examine the patient. In order to obtain a red reflex, first of all prepare your ophthalmoscope. For this procedure, we want a round aperture of white light. We want quite a high intensity. Ensure the room is in darkness and then get your patient sitting comfortably. Ask them to look straight ahead and focus on an object on the wall so that their eyes don't move during the procedure. Then using the ophthalmoscope to shine the light on each eye, you elicit the red reflex. If you're having problems eliciting this reflex, ask the patient to quickly look into the light, and this should be enough to elicit that reflex. For performing fundoscopy, again you want the room to be in darkness. Prepare your ophthalmoscope again, and you want a round white aperture of light with quite a high intensity. For this procedure, you want to stand about 15 degrees temporal to the patient's visual axis. Ask them again to focus on something directly straight ahead on the wall so that their eyes don't move during the procedure. To aid in this, gently position your hand on the patient's forehead so that they further don't move their eyes or their head during the procedure. For examining Ed's left eye, I want to hold the ophthalmoscope in my left hand and bring it up to my left eye. I'm standing just 15 degrees temporal to Ed's visual axis. I'll steady his head with my right hand and obtain the red reflex. I'll remove my hand just now so as not to obscure the view. As you move in closer, turn the magnification wheel clockwise to focus in on the optic disc. If you're having trouble locating the optic disc, remember, keep your red reflex in view. Locate one of the nice thready red veins and follow them nasally until you pick up the optic disc, which should look like a nice bright light, white light shining out of the pupil. If you move from your 15-degree position after locating the disc and plumb straight on looking at the eye, this should be where you will locate the macula.